And warm welcome, dear all. Today, IFPH is conducting its 2112th day of uninterrupted daily webinar series. And I am cordially invite all the participants to this platform. So, before starting, 1 minute silent prayer. Thank you. I am Dr. Sheila Prem, today's moderator. Today, our guest is Dr. Mital P. Joshi, BHMS MD scholar, homeopathy consultant, and she is practicing homeopathy since 2002 in consultant homeopath at Homeopathy Clinic Ahmedabad, currently pursuing MD in Materia Medica. She augmented a book, Gargartu Homeopathic Upajar in Gujarati in 2012, 2022, sharing insights through both paper and oral presentation at national and international seminars. Founding member of Homeopathic Journal India, assistant editor of HJGIF, and our topic is drug picture presentation Stramonium. So let us welcome our guest, Dr. Mital, to this wonderful platform. So, yes, ma'am, now you can begin. Ma'am, can you unmute now?
Yes. Now I can.
Okay.
Now
Thank you. Yes.
So thank you, Dr. Sheila. Thank you so much. And a very good evening to all of you. See, it is my third session with IFPH, and honestly, it gives me an immense pleasure to be back on this platform. And I consider it my privilege that I am being invited. So thank you all again for inviting me. Our topic for today is Stramonium in adults, a case series. So why Stramonium? See, Stramonium is a first year remedy. Everyone knows. So what is big about Stramonium? Unfortunately, what we know about Stramonium mostly is bedwetting, stammering, and night terrors of children as a pediatric remedy. So I thought, let me just share my experiences. I mean, I know most of you would have had your cases of Stramonium as adults, but I thought, let me just share what I have and what I have learned over some experiences that my practice that has taught me in Stramonium. Right? So let us start with the basic difference. What is the difference between children and adults? How are children different from adults? See, children are very transparent. That is the best quality about them and the worst quality about them. So whatever it is there, it is on their face and in their actions. If they are angry, they will shout, kick, bite, scream, anything. If they are sad or hurt, they will cry and they will wail, like literally they will throw a temper tantrum or cry. If they are happy, they will dance. And if they are feeling upset about it, they will cling to you. As we grow up, our defenses start increasing. So we start making walls around us. We learn that our emotions are not the best qualities to be shown to the people. So our emotions start getting hidden beneath our defense mechanisms. Hence, all things that we say or talk about are very guarded. And that is why, even if we are terrified or insecure, we may come across as a rude or very confident person. And that makes Stramonium, the picture that we see in Materia Medica, very scared, timid person, very different as in adults. So in adults, the conditions, not the diagnostic conditions, diagnosis may be anything, but we often see the panic state, the fanaticism, the paranoia, or residual effects of some stress or some fears like PTSD remaining long over the time. So from the beginning, what is Stramonium? Dhatura in Gujarati. I don't know what is it called in any other language, but in Gujarati we call it Dhatura. So Dhatura has a lot of mythology. It is a flower that was born out of Shivji's chest. One text says this. Another form of text, it says that Dhatura was the flower that was put on Shivji's head to stop the burning that was caused due to the poison that he kept in his throat. the halahal poison. It led to burning, and so Datura was placed on his head. In European and folklore, Datura represents a transitional space, that is an edge of between the reality and the dreams, acting as an agent which helps the person to enter an otherworldly state. In Native American folklore, it is widely integrated into sacred visions, coming age ceremonies, where the Datura was given as an hallucinogen designed to open the portals of the earth. So it has a long psychical history. But coming back to science, Stramonium belongs to the Solanaceae family. And in Solanaceae family, the main sensations are sudden, violence, tearing, pulsating, constricting, pursuit, murder, killed, etc. So with belladonna, we have extreme violence, heat and intensity. With hyoscyamus, we have shamelessness, suspiciousness, and jealousy. In veratrum, we see collapse, and in opium, we see terror and helplessness. But with stramonium, we see a lot more. Not taking further much time, let us start with a case. So Mr. AGM, a Muslim lecturer, came to our clinic with the chief complaint of body aches. This whole body was aching since last 1 year. He's also a known case of hypertension since 15 years and is on antihypertensives. This body aches, all his reports were normal. The allopaths, they didn't know whether it was idiopathic or psychosomatic. So they did not give any diagnosis and said you should just rest, take multivitamins and you will be better. We asked when does the pain increase and decrease? The pain increases on standing up and better with motion, but aggravated with continuous motion. He loves to eat sweet and sour foods and has excessive perspiration on eating. Sleep is good and has occasional aphthous ulcers in mouth. Family history is of diabetes and asthma. Let us go to the life sketch. So the patient is born and brought up in Dholka. Dholka is a very small town near Ahmedabad. So he did his schooling and graduation from Dholka. For post-graduation, he came to Ahmedabad and got settled here. Father is a tailor, mother is a housewife. He has two brothers, one elder and one younger. So as you can see, father is tailor, not much educated. Neither of his brothers studied much. One is 10th pass, other is 12th pass. So this patient is the only one who not only completed schooling, he did his graduation and his post-graduation. So in patient's words, though our economic condition was very low, I never suffered because my father and my two brothers, they always took care of me. I always got what I needed. I never had any issues. And not just issues, he's actually still very well respected in his family. And what he says works. He describes himself as a very helpful person. He helps all the people, all his students who are financially weak. He helps them in Viva. He says, I cannot help them in theory, but I would help them in Viva. I will just nudge them the answers and they can better. I give free tuitions to poor students. He also provides financial support now to both his brothers, giving it back what he got when initially. He says he does not like responsibility. In a sense that he was offered a promotion of being a principal. He rejected. He said, no, I love what I'm doing. Let me do what I teach. And this all paperwork and everything, I don't want to do it. I don't want this headache. So he says, I don't like responsibilities. He does namaz 2 hours a day daily. So for 2 hours, he religiously takes time for religious activities. He loves company. And when we asked what about company, he says, no. I'm just not comfortable being alone. I prefer people. It is not that I'm scared. I don't get scared easily. I just like people around me. I don't like to be alone, especially when at night. What he fears? Accidents. And then he started in Ahmedabad, people are such a rough drivers. And this young people, the kids, that students that come to our college, they're very bad. So I am scared of, always scared of accidents. He dreams of Mecca, where he had been before 2 years, and still continues. So considering the totality, his inability to be alone, his religiousness, his false bravado, and dreams of Mecca, Stramonium 1M was prescribed to him. Over the course of 6 to 7 months, 1M was prescribed 2 to 3 times, with which all his body aches went away. He is still on antihypertensives because his body was used to it. We did not stop it, neither did patient. So, what is about the dream of Stramonium? Psychologists believe that dreams are the language of the unconscious mind. In Stramonium, the unconscious relives, right? Not relieves, relives. I think slash is missed. Overwhelming the terror and desperately searches for protection, light, and human connection. So the core symbolism of the dreams that we get are abandonment, helplessness, being hunted, unsafe, religious, etc. The unconscious of Stramonium mind, as I said, it really is the moment. So it does not feel safe enough to be peaceful. It cannot rest. So if we consider it in the symbolic dimension, it represents the primitive terror that emerges from the darkness, isolation, and loss of protection. So very often we find the survival dreams in patient. The dreams of survival in the kind of like trauma responses, you can see various kind of dreams of surviving any calamities, dreams of being pursued, annihilation, or religious. Just last week, I had a patient, an Australian guy. He is a 22-year-old and he came for hypertension. So what his dreams were, he dreamed that, oh, I am safe. There is flood in Australia. Everyone has drowned, but I am safe. Nothing happens to me. His father described him as a very timid guy. I ended up giving Stramonium to him, but that was his dream of surviving a calamity. So let us discuss one thing at a time. What does the dream of abandonment mean? In patients, we see something like being lost in unknown places, searching endlessly for something, losing family members, crying for help. It is like I am alone and I am in danger, and everybody has left me. So nobody I know is there, and anything can happen to me. There is a delusion of Stramonium, right? Being alone in a wilderness. So as if he's in the wild, he's in a jungle, he's absolutely alone. There is a snake there, tiger there, lion there. Anyone can come anytime and pounce on him. And he has no one to take care of him or to hold on to. So he's crying for help. Then we see dream of helplessness. Helplessness means I am not able to do anything. I'm naked in public. I'm chased. I cannot escape. I call for help, but nobody is coming. Very often patients give us the dream that, oh, I'm trying to scream, but no voice is out of my throat. The structures are collapsing. The world is falling apart. And I myself cannot do anything on my own. As I said, being alone in wilderness, helpless feeling. Somebody is chasing me. Somebody is following me. Who is following? Criminals, murderers, animals, ghosts, unknown people, anyone. I'm alone in the darkness and there is no one, no protection. I can be attacked, murdered, or persecuted. The unsafe dreams. I'm surrounded by threats. I'm surrounded by flood around me. I'm falling into an abyss, well, or closed spaces. I'm in an unfamiliar place. I'm caught in darkness and I cannot get out. I'm surrounded by. So it is like Psychologically, you can say that Stramonium psyche cannot integrate the fear. Once some fearful thing happens around him, he cannot digest it. He has to externalize it. We'll see it further in a case. Then we see religious dreams. The thing about Stramonium is like people, the Stramonium people, they're always like our patient, right? You saw that his dreams of Mecca. So basically, it is like seeking light. What is light? It is like counter to darkness. There's darkness all around me. I need something to hold on. It's an attempt to restore safety. God, praying, running, escaping, anything. So we see two kinds, the dark side or the light side. If you go to the dreams, the darkness like terror, darkness, pursuit, monsters, or protection, God, light, connection, mother. Dreams of a frightened soul. Light trying to survive amongst the overwhelming darkness. Symbolically, if we go to the psychosomatic, psychological, analytical aspect, darkness is the terror. Fear of darkness is fear of unknown, annihilation, and loss of protection. Pursuit is persistent fear or memory, unresolved trauma. Animals is primitive, the fear that we first had when we were living in caves. It's a primitive survival fear, evolutionary threat. Prayer, seeking cosmic rescue. Nakedness, vulnerability, regression. Light, safety, consciousness, protection, maternal comfort. Monsters, so externalized unconscious terror. We'll go to that again ahead in like separation, attachment panic, annihilation, and violence, survival activation, and abyss is helplessness. Again, a case, a 46-year-old female. She is Jain and she is a housewife. She has come for depression. Now she says the first thing that she says is, I cannot, people come and say that I don't remember anything. Her point, the first sentence was, I cannot forget anything. Everything remains in my mind. If someone does something to me, someone says something to me, if someone hurts me, it just remains and it goes on and on and on. No, I don't brood. No, I don't take revenge. But it just does not go out of my mind. The chaos remains. It's just a complete tangled thing, right? And this causes very severe stress. Her theory is that this is there because someone has done something to her. I was not like this before. Somebody did this to me. Who did this? So they visited Nal Sarovar. I don't know if you know or not, but in Ahmedabad, there is a Nal Sarovar. It is a bit far from Ahmedabad. It's a water sanctuary where migratory birds come for, I think, 2 or 3 months now. Initially, they used to come for 4 months. But in winter, 2 to 3 months, the migratory birds are there. And people travel to Nal Sarovar just to go and see them. So she had gone to Nal Sarovar with her family. And as I suppose it's in whole India, because it's at least in whole Gujarat, we have this like some evil influence, and to remove the evil influence, you will take one water pot and move around your head and throw the water on the crossroads. Put some, there's some red clothes, there's some coconut, half coconut, and kumkum and everything. And people, if they travel, they would go around it. They will not cross it because they say the evil will be there with them. Now, this patient, when they were traveling, they crossed it by mistake. And she said, after that, my mind has gone down. After this, I'm not feeling good. In between, the situation was so bad that she could not even recognize her husband. She tried committing suicide. Now it is okay, but she still fears that something is affecting patient, her parents, and her husband. She tried taking psychiatric medicines. That is what made her okay now. But she stopped it because the weight was increasing and she cannot tolerate that. The fear is so strong that I feel someone has done something to my family. Let us go to the life sketch. She was born and brought up in Ahmedabad. Father is straight, mother is loving. So father never used to beat. He is just strict person. Mother is loving and she has an elder brother with whom patient is very, very close. She says both me and my brother, we are similar. We don't like talking much. We are silent, reserved people. But we don't tolerate anything bad happening to us. We have to give it back. Brother is still very taking a lot of care of her, about her. She did her schooling from Ahmedabad. She said, I changed a lot of schools. So we asked why. She said, because my friends changed it. I don't like making new friends. If I make friends, they are for life. So what happened 2 to 3 times was she had 2 or 3 friends. The friends' parents, they made them change the school. So patient made her parents change the school. I will go where they go. The end of the story. She got 59% in 12th and 52% in 12th. She failed in final BCom. She said, you know, doctor, since the beginning of times, I was very bad at studies. I never remembered anything in exams. In fact, before exams, I could not sleep. I had headaches. I could not eat. I was so scared. What will they ask? How will they ask? What if I don't know? What if the time is less? What if my pen breaks down? So she had so many theories and fears that at the end of everything, should bomb the exam. So because she failed in BCom, she did ITI and taught in primary school for 6 months. Post that, she left the job and stayed home till she got married. That is a 5-year duration. Before she got married and she left her job. She said, I was very happy helping my mother in doing chores, household chores. Why should I work? It's okay. Then she goes back and says, now it's my mother-in-law. It's all the problems in my life are because of my mother-in-law. So as I said, she was not working before her marriage. She was not working after her marriage. She has not worked. The situation with the in-laws' house is such that husband is very well, doing very well in his profession. So the house in which the mother-in-law, father-in-law, elder brother, and elder sister-in-law are living is bought by her husband. She got married into the house. So for initial 10 months, the mother-in-law took very good care of her. You know, the earning son and his wife. So mother-in-law was extra caring. Problem started when she got pregnant. According to her, the mother-in-law was very jealous and scared. She thought if I get a son, she will have to give all this property to me. So my mother-in-law started disliking me. So what did they do? What did mother-in-law do? She said, my mother-in-law, you know what she did? She would come to my bathroom and she would misplace the things. She would take this from this, rearrange the stuff. She would then harass me. She would make me do all the chores of the house and not cook. So if guests come, the mother-in-law would say, oh, this daughter-in-law, she doesn't know how to cook. We have to cook because of that. She's not good for that. So her impression would go down, even though she's been working since the whole day. Then mother-in-law would pick up fights now and then for small things. It continued and she tolerated. Then for delivery, she went to her parents' house. And when she came back from her parents' house, there was a small issue. And that time she just snapped. Because she snapped, the father-in-law said, we don't like this girl in the house. Divorce her. That is when the husband took stand. And he said, okay, we are leaving. So then husband and patient, they both separated to a new house. Patient said, that experience, I thought I will not survive. How will I manage? I have got a young kid, new house, not even our house, it's a rented house. Because the house that we bought, we are already giving it to them. How am I going to manage? That was so scary for me, I could not sleep. Even today, often, she wakes up from the sleep, with the feeling that, oh, how will I manage? And then the husband calms her down that you are already managing. We are doing good. So forget about it. But she cannot forget it. She describes her husband as a very caring and supportive person and herself as a very religious person. She says, I am always praying and chanting. Whenever I chant God's name, I'm okay. I feel everything will be okay. I'll be at ease. She cries at very small matters. As we said before, she is reserved and taciturn, also clinging. Like for her friends, whenever the friends go, she will go. She cannot tolerate anything wrong. She answers back immediately, and she can answer back anyone except her mother-in-law. She says that lady, she scares me. I cannot do anything to her. Husband, we said, we asked, we sent a patient out and the husband was there. And so we asked, how is your wife's nature? He said, my wife is a very anxious and suspicious by nature. How so? So if my kids, someone is talking to my kids for a long time, she would sit and say, why are they talking to them? What do they need? They will do something to my children. So that thought again goes on. So here we see an evolution of disease from fear to delusion. Initially fear. How will I manage? I don't like to be alone. I want to be with people. Right? To the delusion that someone is out to get me. Anxiety, suspiciousness, frightful delusions, say delusion of danger, delusion she is injured, she will receive an injury, delusion she will be killed, she will be murdered, delusion there are ghosts, spirits, evil. So from fear to an delusion, there is a very nice evolution that we can see here. It is a mind which is dominated by fears and suspiciousness. Her sentence was, as I am telling you, I am scared that this will happen to me again. So the fears like darkness and closing eyes to suspiciousness that mother-in-law will kill her or harm her. Yeah, one more thing. She does not eat anything if her mother-in-law. Yeah, when they separated, so for 5 years there was no relation. Then the relations improve with in-laws. So today, if her in-laws come to her place and give her something to eat, she will not eat. She will throw it away. Why? Because it will be poisoned. She does not keep anything that her mother-in-law brings to her house. It will be poisoned. It will be something evil would be done to it. Anything will be there. So everything is out. So the characteristic totality of intense terror, fears, delusions, of persecution, suspiciousness, clinging. We gave her Stramonium. Stramonium 1M was given. It took around 8 to 10 months for her to get better. You cannot say that completely she changed. No. But she still gets fears. But when she gets fears, now she chants something and she's okay. She remembers God and she's okay. She's much, much better than what she was at that particular time. So what is this fear of Stramonium? What does this fear of annihilation mean? The repertory says annihilation. What is annihilation? So dictionary says I may psychologically or existentially cease to exist. What is it? It is a deep primitive fear, a terror on self-identity, that something bad will happen and I will not exist, not just I will not live or I'll die. I will not exist in this universe. So a deep primitive terror that one's identity, mind, or existence may completely collapse, disappear, or be destroyed. It is much more overwhelming than ordinary fear. See, what is ordinary fear? I'm crossing the road and I see I'm going in a small lane and I see 4 or 5 dogs there and I get scared. Someone will bite me. That is fear. I'm scared. Anxiety is something dangerous might happen. Tomorrow I'm traveling in a train and what if the train meets with an accident? What if the flight breaks down? That is anxiety. But annihilation is not situational fear. It is existential fear. Fear, anxieties, they are situations. This situation happened, this will happen. But annihilation, that my existence will completely collapse. I will not be able to tolerate it. A severe trauma can cause this. So when fear or anxiety loses the threshold, it goes beyond the threshold of a human psyche, you go to the fear of annihilation. If we go to the neuropsychology of this. So in brain we have amygdala. What does amygdala do? It detects danger and threat. So you see that this is bad for you, and then there is hypervigilance, there is increased heart rate or in panic response, defensive aggression. That is what amygdala is. What does limbic system do? It stores memory. So if something bad has happened to you, your limbic system will store it. Oh, this has happened, this has happened, this has happened. Let us put it aside. And then along with it, we have default mode network. So default mode network, its sole function is to maintain the stable sense. So during severe trauma or psychosis, the network's work is just to keep those things safe. So now imagine all three of them working together in your mind. Limbic system will remember this person has harmed me, he caused me harm. Amygdala will give a terror response. And default mode network is, what will I do? Derealization, fear of going mad. How will I maintain that my sense of I? So these three things together, it makes the classic Stramonium picture. A picture of absolute terror leading to violence. So you fear, the limbic system remembers the fear, and amygdala has violence. Why? Because the default mode network says your mind's psyche should be okay, let the world go to hell. This fear has 4 steps, 4 levels. It can be physical fear, fear of body destruction like death, disease, COVID, accidents, or psychological fear. I'll go mad. If this goes on and on, my mother-in-law is going to drive me crazy. It's a very common sentence you see here in a married female, sometimes or the other. That something will, my kids will make me crazy. They are there to just ruin my psyche, etc. The psychological fear. Or the emotional fear. What will I do if they are not there? I cannot survive. Abandonment. Or the cosmic fears like darkness, vastness, and eternity. So subjectively, it can be, just a sec. I need to really minimize this. Just, yes, yeah. So subjectively, there can be, patient might be experiencing or telling you unbearable inner emptiness, or falling endlessly, darkness swallowing, fragmented beyond repair, or losing the reality of self. But symbolically, it appears as fear of black holes, fear of monsters, fear of deep oceans, snakes, ghosts, fire, darkness. So becoming nothing and trapped in chaos, consumed by void, or being fragmented. As we initially I talked about defense mechanisms. So these are few examples of how does an adult control the fear of, how does the adult deal with the fear of annihilation. So either there is a control, like everything should be in my control. This should be like this should be like this should be like this. So nothing out of the blue would happen that will disturb my peace. Or there is aggression, fighting the perceived threat, the first doubt of threat, and you just fight it out. Or there is clinging to someone who can help you, protect you. Dissociation, it is not happening to me, escaping from the overwhelming thing. Everything is happening and I'm reading a book. I'm dissociating myself from the situation. Grandiosity, I am feeling invulnerable and powerful. We have like delusions, I am God. or feeling of purpose, doing purpose. So create certainty and organize things. From homeopathic perspectives, we said control, right? So arsenic alb, I need absolute control. My things should be where I put it, nowhere else. They cannot rest until things are at proper place. Insecure people, anxiety about small things. Or you have lackeses, jealousy and control. Control along with jealousy. He should do what I want him to do. He should talk to only people whom I say yes, no one else. And then we have got aconite. We all know aconite. I will die at 2 a.m. today. He predicts the time of death, terror after sudden fright. And of course, the Stramonium. The world is terrifying and destructive. Terror of darkness, fear of being alone, post-traumatic terror, or violent imaginary. Let us go to another case. Mr. NPS, a retired ITI professor, and he came with trigeminal neuralgia. So this is a very nice case. I mean, like he stated that I come with pain in my right side. Initially, there was pain in neck, then there was double vision, then there was headache, and then he starts ranting, absolutely ranting. He says, doctor, I see things differently from you guys. You people, you were so scared of COVID. I believed that COVID came to reduce the Earth's population because God does not want Earth to be overpopulated. Lord Krishna's 9th avatar is going to come and everything will be okay. You all know, Dwarka, right? Dwarka is a Dwarika Nagari. It was established by Sri Krishna. It's in Gujarat. So then he started inviting us to Dwarika. He said, come to Dwarka. Everyone knows me. I'll give you the best accommodation and you can go to the temple and you can meet the priest and you can do puja. And only then you will get moksha or you will not get moksha. Okay. So we brought him back to the case and he said, okay, let us first tell us how does your pain increase or decrease? So he said, okay, right side pain increases on washing face, chewing, draft of air, brushing, bathing teeth, etc. This is his family history. Father 85, mother 78, brother 55, sister 58. Wife is 55, son is 25 and daughter 32. Life sketch. He was born and brought up in Surendranagar. It is a district in Gujarat. He did his, he was a very mischievous kid. As a kid, he was very mischievous. He would jump in ponds, loved playing cricket, football. He said he was always weak in maths. For college, he came to Ahmedabad and then did a private job from 1984 to 1987. He said, in Ahmedabad is such a big city. I did not know anyone. But with the grace of God, I got a job in ISRO, Indian Space Research Organization. God has been good to me. He got married in 1988. He describes his wife as a very straightforward person who answers back anywhere, anytime, anyone. He says, I am very different. If you tell me it is day, I will say, okay, it is a day. If you tell me it's night, I say it's night. I don't care. Let go. How does it make a difference? But my wife, she cannot let go. She has to answer back. He has conflicts with his brother because his brother has a habit of contradicting him. He took voluntary retirement in 2017. Why? He said, I want to do social work. As I said, the patient is very interesting. He said, I want to do social work. Why do you want to do social work? Because I want to build up my karma. Why do you want to build up your karma? He said, you don't know anything. You know, you remember God. I remember God. We remember him daily. God should remember us daily. We should be in his books. What do you mean by that? He said, do you know Mirabai, Narsi Mehta? They are in God's books. I want to be in God's books. So for that, I will build on my karma. I'll do all the good things. He should remember us. God is someone who runs the whole universe. And yet, people question his existence. You juniors, you people, you don't understand what God is. Good karma builds up. You know, my Guruji, he has immense knowledge. My Guruji's knowledge is not for you guys. Mirabai got dispersed at Dwarika in God's idol before 6,000 years. But why am I telling you this? You will not even understand. You're not worth it. You don't have that mental capacity. And then he again starts the same thing. So he's very rude when he says that you don't understand, but he does not put his topic aside. He will go on telling you how good it is. His parents were another reason why he took voluntary retirement. His mother has memory issues. She has dementia. So she keeps on saying the one thing again and again and again. Father has hearing problems, so he's of no help. Mother asks very uncomfortable questions. Anywhere she's spiraling down. And this is causing a lot of issues. Patient says, I am both calm and irritable. I have no fear, no dreams. But again talks of karma and spirituality. I don't fear anything. Happiest moment, spiritual events. Right? So wife was not in the opinion of him taking a retirement, but patient did not hear her, listen to her, and he took left the job and came home. These are his constitutional tendencies, nothing much specific. This is the MRI report. And the rubrics that could have been thought. We actually gave him Stramonium. But retrospectively, the rubrics that came to my mind were eccentricity religious, excitable religious, desires light, moksha, and mind insanity religious. He was given Stramonium 30 BD for around 10 to 11 months, with which his neuralgia first reduced and then went away. So the known rubrics of Stramonium are light desire for company, hallucinations, delusions, religious mania, or violence. So what is light desire for? What does light signify in patient? At a very literal level, patient likes light. He cannot not sleep in darkness. But symbolically, light symbolizes with protection, security, and survival. Patient is alone, cannot live alone in dark, and light is the company or the protection that he wants. He desires company. He needs some reassurance, clinging. There is various hallucinations, monsters, ghosts, or delusions like pursued, murdered, attacked, injured. There is religious mania, the fear of damnation, like our patient wanted to be in good books of God, not in you and me, right? And the violent screaming and shouting, again, which stems from the sudden fear. Like I said, the amygdala and limbic system and default mode network. So this cycle goes. Now the interesting thing about this cycle is suspicion can cause trauma, trauma can cause suspicion, panic can cause trauma, trauma can cause panic, panic can cause insecurity, panic can cause suspicion can cause insecurity. So it is interchangeable. Though I have put it in this way, it is very much interchangeable and yet it falls into the Stramonium domain. Another case, the fourth case, it is a case of a 23-year-old female. She has a 9-month-old daughter and she is a housewife. She has arthritis for 1 year. So it started from the 6th month of pregnancy. And she has, at present, the daughter is 9 months old. So initially there was swelling in the left hand, which was ameliorated by ice. But now even the winters or sour food aggravates. She feels that her muscles, joints, everything has weakened and she has got indigestion since 1 month. She loves spicy food and was constipated before pregnancy. Post-pregnancy, her bowel movements got regular. Perspiration on palms and soles. She is startled in sleep and sleeps in prone position. This is her family history: diabetes, heart disease, and kidney stones. Gynec history, menarche, cycle, everything is nothing much. Like before menses, slight straining in legs, nothing extra. Full-term normal delivery and no other complaints except joint pains. These are investigation reports and her life sketch. So she was born and brought up in Ahmedabad. Father was a driver, mother was a housewife. So her story is that she was a very lively and extroverted kid since childhood, taking part in all the extracurricular activities. She said, I'd like to do everything except studies. Forget studies. I never wanted to study. So she would just draw, dance, sing, loved giving stage performances, and everything was fine till she was in 10th standard. In 10th standard, what happened was that her father was diagnosed with brain tumor, stage 3. That was a very scary phase. They didn't know whether the father would survive or not. And if he survives, what his condition would be. It was just because of the help and support of her Nanaji, her maternal grandfather, that she could come out of it. When she talks about her college, she says, I keep to myself, not much friends. Now the story is interesting. As I said, the father was a driver and he had brain tumor. So the financial condition was not that good. She also had lots of extracurricular activities and so a lot of classes. So she took admission in government college. The thing was that in government college, everybody was of the same socioeconomic class. But she felt that everyone was very low socioeconomic class. You know how they are? How can I mix with them? How can I make friends with them? It is so difficult. And as such, I'm a person who answers back at any moment. So if someone says something, I have to answer it back. I am short-tempered. Still, I tried to make friends with people, but I could not. They turned out to be very selfish individuals. And so then I thought that I'm better off being alone. I don't need such friends. She says her nature, as she says, short-tempered and impulsive, reacts immediately. She likes to keep everything clean. She has a 9-month-old daughter and she washes all her kids' toys every 2 to 3 days. Nothing should happen to them. Right? She's impulsive, reacts back immediately, speaks whatever comes to her mind. Anger is there, but it's quick to subside. She was doing private job. She was working. But the thing is that because of her arthritis, the physician and the job required a lot of traveling. So the physician said that you have to travel and you are aggravated with motion and there is swelling and then sour food. There is no restriction in food. So stop that and let us just be at home. So she's left the job. She likes all people who are of superficial. This is our observation from her talks. That she disliked superficial conversation. She looked down upon the college colleagues as she preferred that they were not up to her standard. She regrets helping people who criticized her. Has been extremely fastidious since childhood. Cleans toilet multiple times. She had love come arranged marriage. And in-law side, everything is good. Husband is the only child and everyone takes care of her. In fact, she came with her mother-in-law and the mother-in-law was the one who was carrying the kid because patient was not advised to hold the kid for a long time. So these were her fears, cannot remain alone in darkness, dreams of snakes, water or seashore, and easily startles in sleep. These were the rubrics. And on the basis of these rubrics, we can see that Stramonium is the one that covers everything. So Stramonium was given. Calcarea carb was given initially because of this as a chronic of Stramonium. And when the case ended, we gave her Syphilina. These are her reports. Our RA test, RA factor was 246, which came down to 20. So the adult Stramonium personality, as we can see, it's very strong, assertive and dramatic, but internally they are very terrified, insecure and childlike. It's a very unique combination that they need closeness, but they distrust people. And there is a constant fear of abandonment. They end up being possessive, but not to the extent of legacies. So relationships are unstable and a bit dicey with them. Thank you. That's all for today. Thank you again.
Thank you so much, ma'am. It was a wonderful presentation about Stramonium because before we know only about the superficial, only about Stramonium it is. Now we are going deep into it. So thank you so much for this insight into the Stramonium or our remedy.
Thank you. Thank you so much for inviting. Ma'am, you got mute.
Yeah, okay. Sorry, ma'am. So it was a very nice presentation, ma'am. So what we know Stramonium before is only the superficial thing, I think. Now we are deeply into it and we know all the detailed about this Stramonium. Thank you so much for your wonderful case presentation also. We never expect in some cases we will give Stramonium.
Yeah, that's true.
Yeah, that
That's true.
much because you have a vast knowledge into this remedy. So that's why. Otherwise, it will not happen like that. Anyway, those who want to ask any question about this, you can ask. Dr. Dhanesh, sir, any comments about the speech?
I don't.
Dhanesh, sir? So, Dr. Ram Parvesh, sir, you can give vote of thanks to ma'am.
We have some
Yeah,
more minutes.
yes.
Yes,
Thank you.
Yes, sir.
Thank you, Dr. Sheila, and congratulations, Dr. Mital.
Thank you,
Very
sir.
nice.
Thank you, sir.
Excellent. A picture of Stramonium. Stramonium is a very good remedy, child and adult. Stramonium is the one the cheap remedy for intense fear, terror, and violence and delirium. So, differential belladonna hyosamas Stramonium. Stramonium, Hindi name Dhatura. Dhatura is called
Datura.
a kind of poison remedy, है ना? Stramonium Dhatura gift यानी worship of Mahadev.
Yes.
Mahadev.
Yes,
So
sir.
very good presentation.
Thank you,
और
sir.
जो है Stramonium fear and religious mania.
Yes, sir.
Religious mania and fear of darkness. है ना?
Yes, sir.
So very thanks,
Thank
Dr.
you so much, sir.
Mital,
Thank you, sir,
staff
so
of
much for inviting.
IFPH,
Thank you.
staff of IFPH, whole team.
Thank you,
Very
sir.
thanks.
yes,
Everyone,
sir, again for
namaskar.
inviting.
Dr. Dhanesh ji, very thanks, namaskar.
yes,
Thank
Dr. Mital, it's little bit Joshi. It's
Yes, sir.
really a very good session. You really rocked the session with your knowledge about Stramonium. Because we
Thank
can
you,
see lot of Stramonium children in front of our clinic. Whenever even they may have some fever or sometimes they may have some other disease, but when they reach the clinic, you can see when you start to try to examine the patient will hold the mother just like clinging the shoulders
Yes,
of the
sir.
mother
Yes, sir.
and started crying and frightened, and that itself leads to the remedies in Stramonium. I have seen several times Stramonium 1 and 10 has given wonderful result in the first dose
Yes, sir.
itself. And that's
Yes,
that's how we cannot say that the Stramonium is only remedy medicine for old age people or people of young or adult, but it's a very fine medicine for children. Whatever be the age is not the criteria, but all these things.
Yes,
You can see a lot of children afraid to walk in the street when they come out of the house if there is darkness. Yeah, and they always want light. Light in all means. So you have
yes, sir.
really rocked the session with your
Thank you
knowledge.
so much, sir.
Powerful
Thank you so
summary.
much.
Thank
Thank you
you.
for
Thank you.
inviting again.
Thank you, ma'am. Thank you so much.
Belladonna, Stramonium nearest.
Yes, sir.
Belladonna is bud, BIERD bud. B से burning, I से inflammation, R से red, and D से delirium. Complete symptom
Yes,
of
yes.
belladonna and darkness of जो है darkness of fear in Stramonium and light and fear in belladonna. Thank
Yes,
you.
sir.
Thank you.
Okay, sir. Thank you. Thank you so much, all the participants. I am thanking you all once again. So we are moving on to the Malayalam session. So
Yes. I'm
welcome.
leaving. Thank you.
Thank you. Thank you so much.